afternoon, everyone. My name is Nancee Jaffe, and I am the registered dietitian to the Division of Digestive Diseases at UCLA. And I'm going to be speaking with you this afternoon on the gluten-free diet, deciphering the gluten-free matrix. A matrix is an environment where a material develops. And if you've been paying attention to the news, magazines, maybe your aunt called you, told you to go gluten-free. Gluten-free is everywhere. It's truly become a part of our gluten-free or US environment. So what I'm hoping to do today is to demystify the gluten-free diet just a little bit for you. Roughly 30% of US is following the gluten-free diet at this point in time. So that's a lot of people who are currently eating gluten-free, whether on a regular basis or just trying gluten-free products here and there. Most people have given some form of gluten-free product a taste test. So the big question is, who needs to be gluten-free? So the goal of my lecture today is to walk you through some of the basic questions: what gluten-free is, what gluten is, who needs to be following it, and how to do it safely. Just to remind you, you can always go on Twitter and ask questions. I'll be taking questions at the end of the lecture, and you can do that by going to hashtag UCLA MDChat. So a quick overview of our lecture today. We're going to start by talking about what gluten is, where it's found, and answering the question, is gluten really problematic? Then we'll go into the 3 gluten-related disorders, which include celiac disease, wheat allergy, and non-celiac gluten sensitivity. Lastly, we'll talk about who should be gluten-free, and we'll do a little bit of a gluten-free reality check, as well as how you can go gluten-free the healthy way if you do decide that you want to try it. So let's start by talking about what gluten actually is. Gluten is a storage protein. So what that means is that it is one of the building blocks of a grain. And it actually is only found in 3 specific grains: wheat, barley, and rye. And what it does is it is a protein structure made of 2 different proteins. You can see those listed, gliadin and glutenins. And that makes up about 80% of the protein that we see in wheat products. And this is a really important protein structure because what it does is it acts like a glue. That's actually what gluten means. It's glue in Latin. And what it does is it helps dough to rise, and it gives dough that elastic, chewy, yummy quality we're used to in our bread products. So if you've ever made bread, you know that you have to go through a series of rising processes and kneading processes. So you bind all of the ingredients for your bread together in a bowl, you knead it, and then you let it sit and rise for 30 or 40 minutes. And the next time you come back to that dough, it's doubled or tripled in size. That's the gluten actually being allowed to rise and expand. And that's what gives dough the quality we expect before we put it in the oven and bake it and make wonderful bread. Gluten is also found in all of the derivative grains of wheat, barley, and rye. And that includes grains like farina and spelt and kamut and farro. Not to mention Eimer, durum, wheat berries, semolina, gram. It sounds like I'm speaking gibberish, but these are actually all grains that exist. And all of these grains contain that same gluten protein structure. We also find gluten in products that are made from these grains. So that includes things like malt, which malt is a sweetener that is made from barley. So that contains gluten, as well as things like brewer's yeast, which is also made from barley. We can also find gluten in lots of hidden sources. Believe it or not, it's a binder. So it's found in medications, it's found in salad dressings, in beer, in deli meats, and I've even found it in potato chips. So gluten really can be hidden in lots of locations. And this will become really important when we talk about the gluten-related disorders and how much gluten it can take to make someone sick. So really, it comes down to this question: is gluten problematic? So the answer is yes. Gluten can be problematic for some people. And that's because it has a confirmed toxic effect on human cells, specifically the gliadin part of the gluten protein structure. So you may remember from the last slide I said that gluten is made from 2 different proteins. So the gliadin, what it can do is it can actually cause cells to have trouble dividing. And cells are dividing constantly in our body. This is part of their normal occurrence. It helps us to heal, it helps us to rebuild, and it helps us to be healthy. So it's really important that our cells be able to divide the way that they need to. It can also cause cells to die, and this can be a problem because we need our cells to be healthy and functioning. And the main reason why this can happen has to do with a structure called zonulin. Zonulin is a protein molecule that helps to regulate gut permeability. So this is how easy materials flow through the intestines, okay? And unfortunately, what happens is our cells in our intestine are lined up like this, and there's actually a gate that connects them. And when this gate is open, it allows for molecules to pass through. And this is important that this gate is in check. Sometimes it's closed, and sometimes it's open. Zonulin tells the gate to stay open. And that means that molecules can pass through. And this means that there's an increase in permeability, or the ability of things to move through that gate. And this can lead to problems like diarrhea, abdominal pain, and bloating. So the next question is, does this happen for everyone? And the answer to that question is no. So gliadin is only toxic to people who have certain types of autoimmune conditions or have one of the 3 gluten-related disorders. So this is a quote from Alessio Fasano, who is one of the premier doctors in celiac disease and gluten-free diet research. He works at the Center for Celiac Disease in Maryland, and he's also the head of pediatric GIs in Mass Gen Hospital. And I want you to take a look at the quote at the bottom. He says, so if you argue on that basis, meaning that gluten is a problem, then we should all go gluten-free. It's like saying that gluten is like bacteria, that we need to get rid of bacteria in our body. That's ridiculous. Our bodies deal with bacteria all the time. We're awash in them. So his point is that just like bacteria, which we are surrounded in, our body is littered with bacteria, some of it good and some of it bad, but we have it all the time on every part of our body. And our body knows how to deal with this gluten. It knows how to not let it go where it's not supposed to go. It knows how to fight it off. And the same thing is true of this gliadin protein structure in gluten. So for the average person, they deal with gluten the same way that they deal with bacteria. So not a problem. The only time it's problematic is when someone has one of the gluten-related disorders. So we're going to spend some time dissecting each one of these gluten-related disorders so that you can understand why gluten is a problem for people who have one of these diseases. So let's start with celiac disease. Celiac disease is an autoimmune disorder. Autoimmune literally means the body is attacking itself. So this happens for unknown reasons. For some reason, the body, when something is brought into it, thinks that it's an antigen or a danger, it's a threat. And it creates an army known as antibodies to help break down that perceived threat. And unfortunately, it ends up destroying the body as a side effect. This is what autoimmune means. And in the case of someone who has celiac disease, that antigen or that problem agent is gluten. So when someone who has celiac disease eats gluten, the body perceives it as a threat. It will build up an army of antibodies to go out and attack the gluten. And unfortunately, the small intestine is the one that's damaged as a side effect. So people who have celiac disease, it actually does cause damage to the first 10 inches of the small intestine, and this is where the problem comes in. That top part of the small intestine is very important. It's where a lot of nutrition is absorbed, including a lot of our B vitamins and iron and calcium. So patients who have celiac disease can end up with bone issues like osteoporosis, iron deficiency anemia, or even infertility. These are some of the side effects of an uncontrolled celiac disease. People who have celiac disease have to have the genes. So in order to get celiac disease, you have to be genetically susceptible. And this is good news because it means that if you don't have the genes, you can't get celiac disease. So if you're already following a gluten-free diet and you want to be checked for celiac disease, you can always have your doctor run the genes. And if you do not have the genes, there's no way that you can have celiac disease. On the other hand, 40% of the population has the genetics for celiac disease. It does not mean you will get celiac disease. About 1% of the 40% who have the genes for celiac disease will actually ever show for celiac disease or present with celiac disease. Roughly 1% of the population has celiac disease, so that's about 3 million people in the US. That's a fairly large proportion of the US, but unfortunately only about 13% of them actually know that they have celiac disease. So it's really important that we test and we diagnose and we find all of the people who have this disease so that they can start following the gluten-free diet and be healthy. The way we test is we do a specific blood test looking for that army of antibodies, and then we do what we call a biopsy, which means that the doctor will stick a tube down the throat, take a small little snip or a biopsy of the small intestine, and look at it under the microscope. And this is how we diagnose celiac disease. Unfortunately, celiac disease cannot be diagnosed with a blood test if you are already on a gluten-free diet. You have to be eating gluten in order for us to know that you have celiac disease. So again, if you're already on a gluten-free diet, you can always have the genetic test done. Symptoms of celiac disease are wide-ranging. There's over 300. So I'm just going to name a few of them. The classic form of celiac disease, we expect to see patients with weight loss, diarrhea, abdominal discomfort, and bloating. These are some of the classic signs and symptoms of celiac disease. But most patients who are being diagnosed these days actually have what we call atypical symptoms of celiac disease. This includes some of the things I mentioned earlier: iron deficiency anemia that's not explained by anything else, or osteoporosis that's early onset. They might have hair loss or infertility or problems with their teeth or low height. These are things that we see commonly in people who have celiac disease that's undiagnosed. It's also possible to have no signs and symptoms of celiac disease. We call this silent celiac disease. But unfortunately, the damage is still occurring in the small intestine. So these patients, we have to be very careful and try and figure out that they have celiac disease, even though they're not technically suffering from the symptoms daily of it. And unfortunately, the only treatment for celiac disease at this point in time is a very strict gluten-free diet. And actually, we don't even say diet, we say lifestyle, because it really does take some effort to figure out how to live gluten-free and to keep yourself safe. So you might be asking, well, if I'm already gluten-free, why would I need to be tested for celiac disease? I'm already following the treatment protocols. So I'm hoping that these images will help to answer that question. So I want to draw your attention to the slides on this side of the screen first. So you'll notice what we're looking at is that endoscopy that I had described, where the doctor will stick a tube down the throat and they'll take a pinch or a biopsy of the small intestine. In the top slide here, this is what a healthy small intestine is supposed to look like. You can see that it's got almost grain of sand-like effect in here. They almost look like little rice structures. I call it a shag carpet effect. So this shag carpet is actually healthy villi, or finger-like projections that cover the top part of the small intestine. And these fingers actually go and they grab at food, they grab at nutrition, and they bring it into the body. Which is why when someone has celiac disease and they're eating a gluten-free diet, it's so dangerous, because those villi are not able to do their job appropriately. If we look at those villi under the microscope, this is what we expect to see: really long, beautiful, tall, finger-like structures. That means they're healthy, they're grabbing at nutrition. This is a patient who does not have celiac disease. The slides down here are what we expect to see when a patient does have celiac disease. So you'll notice a nice smooth effect to the small intestine. There's no more villi there. They've been what we call blunted. They're flat. And you can even see that under the microscope. There's no more height to the villi. They've been flattened down. And you'll notice where the arrows are pointing, this is called scalloping. It means that the small intestine has actually started to fold in on itself to try and get more surface area. So unfortunately, the small intestine is trying to grab at nutrition the best it can, but because it's being assaulted with gluten, it's not able to do so. So then the next obvious question is, well, how much gluten does it take to cause this type of damage in someone who has celiac disease? And the answer is 50 milligrams or less, okay? So when we do research studies, we've seen that every patient who has celiac disease, when they do 50 milligrams, they will have problems. And for some patients, it's as low as 10 milligrams. So anything above 50 milligrams we know is a problem. So what does 50 milligrams look like? So you'll notice that we have a big piece of wheat bread right here. And you'll see my arrow pointing to this little tiny crumb. This crumb is 50 milligrams. So you can think of it as the amount that fits under your pinky nail. That is the amount that can cause damage for someone who has celiac disease if they consume gluten. So you may have remembered from my initial slide when I talked about what gluten was and where it was located. We talked about hidden sources of gluten, like potato chips and candy and protein bars. There's enough gluten in those hidden sources to cause damage for someone who has celiac disease. That is why it's so important to know if you have celiac disease, even if you're already following a gluten-free diet, because patients who have celiac disease have to worry about cross-contamination when they go to restaurants. We can't go to bakeries where they're breathing in air that is used with flour, where they're making baked goods on premise. This is a problem because all of that can equate to 50 milligrams or more. So it's really important to work with your gastroenterologist and work with a specializing dietitian to figure out if you have celiac disease. I recommend before you go gluten-free. So what about wheat allergy? Wheat allergy is actually one of the most common allergens we have in the United States. We believe that somewhere around 1% of the population has wheat allergy. So it's very similar to the amount of people who have celiac disease. Wheat allergy is an immune reaction. So you may remember we said celiac disease is an autoimmune reaction. This is an immune reaction, which means that there's also an army of antibodies that are created when someone takes in one of the wheat proteins. So in this case, there are 4 wheat proteins, and you'll notice 2 of them are our gluten proteins. So when someone who has wheat allergy ingests one of these wheat proteins, their body will launch an attack. But the big difference is it doesn't attack the small intestine, it doesn't attack the body, but they will have uncomfortable symptoms. So there's no damage to the small intestine the way there is in celiac disease, but there's definitely uncomfortable symptoms that go along with wheat allergy. The way we diagnose wheat allergy is either through a blood test, a skin prick, or an elimination diet. And usually the doctor will tell you to do some format of all of these. So you might do a blood test and then the elimination diet, or they may have you do a skin prick, then a blood test, then the elimination diet. It's best to work with your allergist and your gastroenterologist to figure out the best way to go about diagnosing or ruling out wheat allergy. The main symptoms we expect from an allergy is usually upper respiratory. So usually we think lungs and above. So shortness of breath or tightness in the chest. Some patients can even feel itchiness or scratchiness in the throat or throat closure. They might get ringing in the ears or dryness to the eyes, or they may feel tingling in their mouth. Some patients even have rashes and hives. And then it is possible a couple hours after you have an episode of wheat ingestion for someone who has wheat allergy to then have diarrhea or abdominal pain that goes along with it. So again, we want to rule out wheat allergy and we want to rule out celiac disease before someone goes gluten-free because, as hopefully I've explained, these are serious conditions and it's important we understand why these patients need to be on a very serious, strict, gluten-free, wheat-free diet. With wheat allergy, they have to remove the wheat proteins, but they can also possibly go on certain medications that can help manage some of the symptoms. This again is when you would want to talk with your doctor to find out the most appropriate course of action. Finally, non-celiac gluten sensitivity. This is probably the most confusing one for patients to understand. And the reason for that is we don't really have a good definition or explanation of non-celiac gluten sensitivity. But let's start at least by explaining the difference between an allergen, a sensitivity, and a food intolerance, because these words are often used interchangeably, but they don't actually mean the same thing. So we talked about what an allergy was. We said it was an immune response. There's an antibody reaction, and usually it's very quick. It happens within 30 minutes to 2 hours of eating the food that is causing the allergic reaction. With a food intolerance, it usually has to do with some sort of nutrient that the body is just not absorbing properly. It's not able to break it down, or it's able to break it down, but when it's overconsumed, the body loses that ability, and it can end up causing digestive distress. So with a food intolerance, it's always going to be GI related, meaning that if you eat something that you're having an intolerance to, you're going to end up with diarrhea, constipation, bloating, abdominal pain. It's going to be changes to the digestive tract. So the most obvious example of this would be lactose intolerance. For patients who have lactose intolerance, they're not making enough of an enzyme called lactase, and that's used to break apart the lactose molecule, which is the sugar that's found in all of our dairy products. So when patients have this sugar in the dairy that they're eating, their body does not know how to break it down, and it causes reactions like gas and bloating and cramping and diarrhea. On the opposite side of that, we've got food sensitivities. So food sensitivities are also immune mediated, but we do not understand the mechanism behind it, not at this point in time. We see that with people who have food sensitivities, when they eat a food, it not only causes intestinal distress and GI symptoms, but it can also cause outside symptoms. So they can have things like brain fog, they can have headaches, migraines. We'll see muscle pain or eczema, skin issues. So a sensitivity can show up in other ways. But again, I like to express that there's no damage that's actually being caused. Not the way that there is with celiac disease. It's just more uncomfortable for the patients. And you can see we have very poor estimates of how many people have non-celiac gluten sensitivity, anywhere from 0.5% to about 6% of the population. We don't know at this point in time how many people have it. So how do we go about diagnosing it? The answer is we diagnose based on exclusionary criteria. So the definition that's given for non-celiac gluten sensitivity, I'm just going to read it, is a clinical entity induced by the ingestion of gluten, so the consumption of gluten, leading to both intestinal and extraintestinal symptoms that resolves when gluten is removed from the diet. And I want you to pay attention to what I underlined: when celiac disease and wheat allergy have been excluded. So you have to rule out wheat allergy and celiac disease with your doctor before we can actually call you non-celiac gluten sensitive if you believe you react to gluten. So this is another reason why I highly recommend, before you go gluten-free, meet with your gastroenterologist, get tested for celiac disease and wheat allergy, rule them out, and then if you want to try a trial run of a gluten-free diet, that's when it's an appropriate option. But something to consider is gluten may not be the culprit, or may not be the only culprit that's happening when patients say that they're having symptoms. There could be other food intolerances, such as lactose intolerance or fructose intolerance. Also, there's a 40% crossover rate of patients with IBS having trouble with gluten. So it's important to rule out irritable bowel syndrome, which is just another disease state that has to do with the GI tract, because that could be part of what's causing symptoms. And there's other cures and treatments for IBS beyond diet, so it's important to work with your doctor. Also, there's a funny word at the bottom of the page there, FODMAPs. This is another diet that actually has been shown to be very, very beneficial for patients who struggle, they think, with gluten. And this is what the diet looks like. So it's a little bit of a convoluted diet. It's very difficult to follow. But the main thing I want to draw your attention to is this line. So you see rye, wheat, and barley are listed as high FODMAP foods on this list. They are listed because they contain a sugar called fructan. So this is not because they contain gluten. It's because they contain a sugar that also causes diarrhea and bloating and cramping and abdominal distress. So oftentimes patients, when they go on a low FODMAP diet, which means they remove these high FODMAP foods from their diet for a short period of time, usually between 4 and 8 weeks, most of their symptoms go away. The thing that's dangerous about this diet is you can see you're removing a lot of really healthy foods. You'll notice that apples and watermelon and garlic and onion are on this list. These are healthy foods to keep in the diet. So you want to make sure you're working with a registered dietitian who's very familiar with this protocol and keeps you on it only as long as is necessary. And then you always want to go through a reintroduction phase to see which ones of the high FODMAP foods were actually problematic for you. Because as you notice, there's several categories to the high FODMAP foods. And I give you some of the top women in the field who are researching and working with this diet. I highly recommend you go to their websites if you want to know more. They have great information, including healthy ways to go about following the low FODMAP diet, registered dietitians in your neighborhood who work with this diet, as well as recipes, meal planning ideas, grocery lists, and all of that. So hopefully we've answered the question, should I go gluten-free? If you have celiac disease or wheat allergy, absolutely yes. Okay, we've said that celiac disease is an autoimmune disorder. It's triggered by the ingestion of gluten. The only way to help someone who has celiac disease is you have to remove gluten, and fairly strictly, from the diet. Wheat allergy is an immune disorder that is triggered by one of the wheat proteins, and that can include the gluten-containing proteins. So we also need to remove gluten from the diet with these patients. What if you think you have non-celiac gluten sensitivity? The answer is maybe. So we first want to start by excluding celiac disease and wheat allergy. Work with your doctor, work with your dietitian to find this out. Once you've done that, you can go through a gluten elimination phase. Usually this lasts about 8 weeks to 3 months. And once you've done that, if you feel significantly better, you can start bringing minimal amounts of gluten back into the diet to see what threshold works best for you. Because unfortunately, we don't know at this point in time how much gluten triggers a reaction in people who have non-celiac gluten sensitivity. It's very individualized. And then of course, consider other things besides gluten that could be triggering you, and that includes the low FODMAPs, fructose malabsorption, or lactose malabsorption. So let's do a little bit of a gluten reality check. Let's say that you rule out celiac disease, rule out wheat allergy. You're not sure if you have non-celiac gluten sensitivity, but you're pretty sure that you don't, but you just want to go gluten-free because you think it's healthy. So what do we do then? How do we do this the healthy way? So one thing I always like to point out is that just because something is free of something else does not mean it's healthy. So we've gone through trends like the fat-free diet and the sugar-free diet, the low-carb diet. And what we found through research is that just removing one thing does not necessarily mean healthy. Oftentimes, other filler ingredients are added to try and compensate for the thing that has been removed. And the same is true when we look at gluten. So I have an example up here of a regular wheat-containing, gluten-containing pretzel and one that's gluten-free. And we're going to just go through the ingredient list because I want to show you that gluten-free does not always mean healthier than its gluten-containing counterpart products. So you'll notice with the regular thin pretzel, enriched flour is the main flour that's used. Whereas with the gluten-free pretzel, we have 1, 2, 3, 4 different flours that are being used to create the same structure as the wheat pretzel. So trying to get the pretzel to mimic the quality of a wheat pretzel. So we're using a whole lot more, and you'll notice they're mainly starches. Starches are highly broken down and very low in terms of nutritional quality. Whereas you'll notice with our enriched flour, we've got niacin, iron, vitamins, minerals, all sorts of things. So these are B vitamins and iron that have been added back in to this wheat-containing pretzel. You don't see that with our gluten-free pretzel. So what's happening is wheat products, by law, have to be enriched. And what that means is any nutrients that are pulled out of the grain during the manufacturing and processing of the product have to, by law, be put back in. That's what the word enriched means. That is not true with our gluten-free products. So these gluten-free products end up being deficient in some very, very important vitamins and minerals. And if we're living off of gluten-free products, this can eventually lead to deficiencies and problems. Also, I wanted to point out that we've got 2 sugar sources in the regular pretzel, and we've only got 1 sugar source in the gluten-free pretzel. But I'm about to show you that our gluten-free pretzel still has more sugar and still has more carbohydrates than the regular product. Lastly, you'll notice that the regular pretzel has a much shorter ingredient list. That's because the gluten-free pretzel has to have 1, 2, 3, 4, 5, 6 different products to fill, to try and make the product hold together. So again, gluten means glue. That's what allows these products that have gluten to be cohesive. They don't need a bunch of binders and fillers to help stabilize them. But unfortunately, our gluten-free products do, and so they end up having a bunch of extra ingredients in them that are not necessarily the healthiest. So what if we actually look at the nutrition facts label of these same products? So we took a 30-gram serving of each one of them, and we looked at the calories, the fat, as well as the carbohydrates and the sugar. And just to give you an idea, these are those little tiny pretzels, and it comes out to about 20 of them. So most people eat a couple servings when they do it, because 20 is just about what you can hold in your hand. So if you ate those 20 pretzels of the regular, you would be taking in 110 calories, no fat, 23 grams of carbohydrates, and less than 1 gram of sugar. But for the same amount of gluten-free pretzels, you get 10 extra calories, 3.5 extra grams of fat, most of it saturated, which is not heart healthy, a little bit extra carbohydrates, and more sugar. So unfortunately, our gluten-free product does not match up to the gluten-containing product. And so what do? Does that mean we shouldn't go gluten-free? Does it mean we should go gluten-free? My response to that is gluten-free products are not necessarily healthy, but gluten-free grains are. So instead of switching your gluten-free pretzels, your gluten-containing pretzels and breads and cakes and pastas for just the gluten-free counterparts, how about we skip the products altogether and we go for the whole foods? So when we make the diet based on whole grains, whole fruits, vegetables, We do healthy, lean proteins, whether animal or plant-based, non-fat, low-fat dairy products if you tolerate them, nuts, seeds, legumes. This is how we can do gluten-free the healthy way. So what are the pros of the gluten-free diet? We said that if you remove the processing from your diet, so get rid of all of those processed products, it actually can lower your risk of heart disease, cancer, and diabetes. And so this is how we do it. We increase all of these natural foods in our diet, and we don't focus on these processed foods. When we focus on the processed foods, that's when the diet becomes unhealthy, whether you're eating gluten-free or not gluten-free. One thing I always like to point out is that wheat, barley, and rye, when eaten in their whole format, are what we call prebiotics. That means they help to feed the healthy gut bacteria that we need in order to have healthy digestion as well as a good immune system. Most people have heard the term probiotics. So you can imagine prebiotics are the food source that feed the probiotics, and probiotics are those healthy bacteria we want growing in our gut. So if you're able to eat gluten, I recommend doing whole grain barley, whole grain wheat, whole grain rye, and then if you want to try some of the gluten-free grains like quinoa or millet or sorghum or the different types of rices, that's a great addition to the diet. Remember, before you go gluten-free or try even a modified gluten-free diet, always get tested for celiac disease and wheat allergy first, and then if you want to try a low gluten diet, then it's considered safe. Just make sure that you're not focusing on the processed foods. What are the cons of going gluten-free? Nowadays, gluten-free foods are more prevalent than they used to be, but it can still be a hassle, and it's definitely still expensive. So I can let you know I have celiac disease. I was diagnosed about 9 years ago. And the price point of a gluten-free products have gotten a little bit better, but it still costs me $8 to get a loaf of gluten-free bread. That's double the amount that it costs of regular wheat bread. So it's an expensive diet. So if you're going to go gluten-free, again, if you focus on whole foods, it's not any more expensive than if you were on a gluten-containing diet. We also want to be careful of any nutrient deficiencies. So make sure that you're getting all of your different fruits and vegetables in and your grains in so that you're not getting depleted from those important nutrients that are missing from the gluten-free products. And then, of course, make sure that there's no other intolerances going on. If you just go gluten-free, you could be missing on some other intolerance that's actually part of the culprits that was making you not feel so good in the first place. So just to wrap things up, if you're thinking of going gluten-free, we want to rule out the gluten-related issues first, so celiac disease and wheat allergy. If non-celiac gluten sensitivity is suspected, you start with a trial elimination of the gluten, and then you reintroduce it to see if the symptoms come back. Also consider other causes for why you might be experiencing some digestive symptoms, including the low FODMAP diet, and make sure that you work with a registered dietitian who's familiar with the diet, because it itself can be very difficult to do, and is only meant to do for a short period of time. And then finally, if you're just choosing to go gluten-free, make sure you do it the healthy way with whole foods instead of focusing on processed foods. So thank you so much. It was really great talking with you today. And we're now actually going to go to the questions that you guys have brought to us through Twitter. So the first one I have here is, what type of doctor can help me if I'm considering a gluten-free diet? It's a great question. So I would personally recommend seeing a gastroenterologist. A gastroenterologist is a doctor who is very, very familiar with the GI tract. And that means that they will know the different types of blood tests they need to run. They'll look at your family history to figure out if you're really susceptible to having celiac disease. And then they'll be able to help you navigate the different diagnoses that are possible, as well as anything else that could be leading to your GI symptoms. So I would highly recommend seeing a gastroenterologist. The second question is, how long does it take for a gluten-free diet to work? So unfortunately, it really is very dependent on who we're talking about, what patient we're talking about in terms of what symptoms they have, as well as what disease state they have. So for someone who has celiac disease, it's possible that they could start feeling better within 2 weeks of starting a gluten-free diet. It's almost immediate. It takes longer than that for the small intestine to regenerate. So usually it takes about 6 months to 2 years for someone who has celiac disease to get all of their villi nice and healthy again, their small intestine healed, assuming that they've stayed consistent on a strict gluten-free diet. For someone who has wheat allergy, again, it's going to be an immediate reaction. They're going to feel better just not having gluten in their diet. But for someone who has non-celiac gluten sensitivity, it really depends. Because if gluten truly is the culprit, they should feel better within 2 weeks of starting the diet. If, on the other hand, gluten is only one part of the problem, or it's actually those sugars, the fructans in the low FODMAP diet that are causing the problem, then there's more foods that contain those sugars than just the ones that have gluten. So for instance, just removing wheat, barley, and rye from the diet would not be enough. You would also have to remove some of the other foods that contain those sugars, such as the garlic and the onions and the asparagus and all of those other foods. So it can take a while, and it can take some detective work, which is why it's nice to have a healthcare team in place who can help you navigate all of that information. When will celiac symptoms stop? So we answered that question. How can a gluten-free diet help me lose weight? So if you are following a whole foods version of a gluten-free diet, that can be helpful in losing weight. But the truth is it's not necessary to be gluten-free, and the research does not stand behind gluten-free being a weight loss diet. We actually don't have very good proof on that. And unfortunately, you saw from my pretzel demonstration that if you're focusing on the processed gluten-free products and you're having gluten-free toast in the morning, and then you're having gluten-free pretzels as a snack, you have gluten-free pasta at lunch and gluten-free bread at dinner, you're not going to lose weight on the gluten-free diet because you're still eating a lot of starchy, flour-based products that are high in calories, high in fat, and high in sugar. So that's not going to help you lose weight. But if you instead go towards a more anti-inflammatory Mediterranean-style diet, which includes lots of healthy whole grains, fruits, vegetables, nuts, seeds, legumes, that is the better way to lose weight. So instead of focusing on gluten as the culprit, think about portions and think about how close to the earth you're eating. So the less processing, the better. What are the disadvantages of a gluten-free diet for celiac disease? The answer is there are none, unless you're only focusing on the processed foods. So again, when you have celiac disease, the top part of the small intestine is what's damaged. And that top part of the small intestine is where we absorb a ton of our nutrition. So the gluten-free diet is the only way to get that small intestine up and working again, heal the villi, and allow for nutrition to be absorbed into the body. But if you're focusing on gluten-free processed products as your only source of food, you're going to be lacking in some of the B vitamins, iron, calcium. And that can lead to deficiencies. So I have seen patients who they come into my office newly diagnosed, they have certain deficiencies, they go on the gluten-free diet, and those deficiencies do not get better. It can either be because, one, they're not following the diet strict enough, so they're still having damage. Two, they're eating only gluten-free processed foods, and so they're not getting the nutrients they need. And so what we need to do is check the diet, make sure they're following it adequately, maybe give them a supplement like a gluten-free multivitamin, and then also re-biopsy and make sure that the villi are actually healing. What causes persistent celiac disease symptoms while on a gluten-free diet? Great question. So we have something called non-responsive celiac disease, or NRCD. Non-responsive celiac disease occurs for a couple of reasons. One, either the gluten-free diet is not being followed as carefully as it needs to. So if more than that little crumb you remember on that one slide I had was a little 50 milligram crumb, if that's in the diet consistently, it can take 2 months for gluten to fully leave the body after you have gluten exposure. And it also takes a while for those antibodies, that army, to deplete. So it takes a while for the body to stop producing those antibodies, like 3 months usually. So unfortunately, it can take a while for the body to stop making those antibodies. So that can be part of it. Or if there's still minute amounts of gluten that are being taken into the body. And remember, it can be hidden in your medications, it can be hidden in your supplements, and it can be hidden in food stuff that you wouldn't expect to see it in, like soy sauce. Sounds like it shouldn't have anything besides soy. It has wheat in it. So you need to be reading your labels really carefully, and if you're still having trouble figuring out why you're having symptoms, then work with a registered dietitian. But most people who have NRCD, that is the reason. If it's not because of that, if the gluten-free diet is really being followed well, the patient is doing a great job being strictly gluten-free, it is possible they have something called refractory celiac disease, or RCD. Refractory celiac disease is less than 1% of the celiac disease population, and this occurs when patients who are following the strict gluten-free diet do not get better. And this unfortunately happens for a lot of different reasons. It's an inflammatory disease state, and usually these patients need to go on different medications like steroids and biologics. So it's really important to work with your doctor. Make sure it's not non-responsive celiac disease. I wouldn't worry about it being refractory, but just keep in mind that it is a possibility, and to follow the gluten-free diet as strictly as you can, because that's really what's going to help you to heal and feel better. What are some benefits of reducing gluten? So we talked about that a little bit. And how does gluten affect children? So in terms of gluten as a problem for just the average person, someone who doesn't have celiac disease, wheat allergy, or non-celiac gluten sensitivity, the research shows that patients who have other autoimmune disorders, so this includes things like rheumatoid arthritis or type 1 diabetes, it is possible that these patients would do better if they were on a low gluten diet. And it has to do with the zonulin that I talked with. So you may remember that I mentioned that in our intestines we have cells that line up just like this, and there's a bridge that connects them. And zonulin is the molecule that comes in and opens the bridge. It seems like in patients who have autoimmune issues, that bridge is opening more often because more zonulin is being produced as a byproduct of the autoimmune disease. So patients who have autoimmune issues may do better on a gluten-free diet, or at least a modified gluten-free diet. So for children, that would be one thing to think about if they're suffering from different disease states like type 1 diabetes or Crohn's disease. They may feel better if they do a low gluten diet, but otherwise gluten is not dangerous, and it does not need to be removed from someone's diet unless they have one of these other disease states. Can you give specific examples of gluten-free grains that could supplement my diet? Absolutely. We call them the Super 8. So there are several gluten-free grains out there. One of my favorites is teff. Teff in 1 cup has more calcium than a glass of milk. So it's a wonderful flour to cook with. They use it to make injera, which is Ethiopian bread. It has a wonderful light quality. It tastes great with molasses and brown sugar and cinnamon and all of these wonderful spices. There's great cookbooks and recipes out there. Also, you can do quinoa, you can do sorghum, millet, buckwheat. I know it says wheat in the title, but it's actually gluten-free. You can do all of the different rices. So wild rice, brown rice, black rice, forbidden rice, red rice. You can also do corn, polenta, as well as gluten-free oats are safe to consume. So hopefully that gives you a good idea of just some of the grains that are out there. There's much more information on, if you go to Shelley Case's website, she's a wonderful dietitian up in Canada who specializes in celiac disease. She has a whole handout free on her website on gluten-free grains and ways to cook and prepare them. Highly recommend that you look it up. It's a wonderful handout. I give it to all of my celiac disease patients. And then our last question. I think I suffer from silent celiac disease. How do I go about getting tested? So as long as you're on the gluten-free diet, you can go to your doctor and request that you have what we call a celiac panel, which means that they would run a set of 3 different tests for you. It would be the anti-transglutaminase, the endomyosil antibody, and they would do the deaminated gliadin peptide. That's a lot of words to remember. So if you just tell your doctor, I need the celiac panel, they will run those 3 tests for you, and they will check and see if you have celiac disease. Also make sure that they check for an IgA antibody deficiency. About 2 to 3% of people who have celiac disease are missing the ability to make the certain antibody called IgA. If they're missing that antibody, it means that they won't be able to test celiac disease the way we normally do. And the doctor will know the other test that we have to run, which is an IgG-based antibody test. But that would be the best way to go about it, is to contact your gastroenterologist. All right, we have one more question. Does a patient who is an athlete have extensive exercises need to take special precautions? So I'm not sure if you mean the athlete has celiac disease or has wheat allergy, or just does gluten in the diet cause an athlete to not perform as well. Again, there's no research to show that gluten actually makes athletes sluggish or not able to perform as well, but focusing on white processed foods will make you more sluggish, because what it does is it forces your blood sugar to spike very quickly and then drop very quickly. When there's no fiber in the product, it makes your blood sugars very uneven, and this can lead to feeling fatigue, sluggishness, run down. For athletes, it's also really important that you're making sure you're getting adequate hydration and adequate protein because otherwise you're not going to be rebuilding your muscles and refueling the system. So I would say in terms of gluten, if you've got one of the gluten-related disorders, then yes, gluten in the diet will definitely slow down your performance as an athlete. But otherwise, as an athlete, do I think it's necessary to go on a gluten-free diet? No. Is it possible to go on a low-gluten diet? Sure, but will it necessarily make your performance any better? I don't have any research at this point in time to state that proves that. Any more questions? Well, thanks everyone. It was really lovely talking with you today. If you want to come and visit me, I'm at UCLA, and I hope you enjoyed the lecture. Thanks.